Welcome back, everyone, to another Medvarsity Deep Dive.
Huh.
Today we're going to be looking at something that I think is particularly interesting for folks like us.
Yeah,
I think you'll agree.
definitely.
When you're dealing with conditions that look really, really similar on the surface,
Right.
but when you get down into the weeds,
Oh, yeah.
there are these subtle little differences.
Yeah, absolutely.
And those differences can really be everything
Oh, yeah, for sure.
when it comes to making a diagnosis.
Absolutely.
So we're going to be talking about COPD, CHF, and pneumonia.
3 big ones.
Yeah.
Yeah.
We're going to look at how you, as a healthcare professional, will be able to
Yeah,
differentiate between these.
exactly.
Before we get into that, though, I think it would be helpful just to kind of remind everybody,
Sure.
what are these conditions actually
Yeah, so
in the first place?
COPD, or chronic obstructive pulmonary disease, basically that's a group of lung diseases that cause airflow obstruction and breathing-related problems.
Okay.
So it's progressive, and essentially, over time, you just have more and more trouble breathing.
Okay.
CHF, congestive heart failure, is a condition where the heart can't pump blood efficiently. And this leads to fluid buildup in the lungs and other parts of the body.
Okay, so two very different
Yeah.
mechanisms, but similar presentation.
Exactly.
And then we have pneumonia, which is...
An infection of the air sacs in the lungs,
Mhm.
which can be caused by bacteria, viruses, or fungi.
Right.
So
again,
yeah.
similar in terms of presentation.
Exactly.
You're going to have that difficulty breathing.
You got it.
But the underlying cause is totally different.
Totally different.
So I remember when I was first learning about COPD,
Yeah.
one of the things that kind of stuck with me were these terms pink puffers and blue bloaters.
Yeah.
What are those?
So pink puffers and blue bloaters, these are kind of like classic descriptions of COPD patients.
Okay.
And they describe 2 different kind of phenotypes or ways that the disease can manifest.
Okay.
So pink puffers, they tend to have a type of COPD that's more emphysema predominant.
Okay.
So what happens is the little air sacs in their lungs, they lose their elasticity. So it's kind of like, imagine trying to inflate a balloon that's lost its stretch.
Right.
It becomes really difficult to get the air out.
Yeah.
And so these patients, they often develop this characteristic pursed lip breathing
Okay.
to try to improve their lung function.
Okay.
So they're literally trying to create back pressure to keep those airways open longer.
Wow, that's fascinating.
Yeah. It's pretty remarkable how the body adapts.
Yeah.
Blue bloaters, on the other hand,
Okay.
they tend to have more chronic bronchitis.
Okay.
So in this case, the airways are chronically inflamed and narrowed. You can kind of imagine it's like a hose that's slowly getting clogged up.
Right.
And so this can lead to cyanosis,
Okay.
which is this bluish tinge to the skin because
Yeah.
the blood isn't carrying enough oxygen.
Okay, so even within COPD,
Yeah.
we're already seeing these distinct...
Absolutely.
Well-
Yep.
So how do we differentiate then between these two and then CHF and pneumonia?
Right. So let's start with something as simple as sputum,
Yeah.
but that phlegm that you cough up in CHF, because the issue is fluid buildup. The sputum is usually thin and white.
Okay.
With COPD,
Yeah.
due to the inflammation, it tends to be thicker and more tenacious.
Okay.
And then with pneumonia, the color and consistency can vary, depending on the cause of the infection.
Okay.
But it can even be blood-tinged in severe cases.
Oh, wow.
Yeah.
Okay, so that's something easy to look for right away.
Yep.
What about swelling in the legs and feet?
Yeah.
I know that's common with heart problems.
You're right. Pedal edema, as it's called, is a hallmark of CHF.
Okay.
And that's because the fluid buildup from the heart's inefficient pumping often settles in the lower extremities.
Okay.
You won't typically see this in COPD except in very advanced cases,
Okay.
where the heart is also involved.
Okay.
And pneumonia being an infection wouldn't usually cause pedal edema either.
Okay, so we've got sputum, we've got
Yeah.
swelling. What about those nighttime breathing emergencies?
Oh, yeah.
Those sound terrifying. They could be very frightening.
Yeah.
Paroxysmal nocturnal dyspnea, or PND, that's what it's called,
Okay.
is a very specific and dramatic symptom. Imagine you're sound asleep and you suddenly wake up gasping for air.
Oh, yeah.
That's highly suggestive of CHF,
Okay.
where fluid can shift in the lungs while lying down, making it very difficult to breathe.
Got it.
You wouldn't typically see this in COPD or pneumonia.
Okay, so if somebody is waking up
Right.
in the middle of the night,
Yeah.
gasping for air,
That's a big red flag.
that's a big CHF red flag.
Exactly.
What about difficulty breathing while lying flat?
Okay, so that's called orthopnea.
Okay.
And it's related to PND in a way.
Yeah.
Because when you lie down, gravity pulls more fluid into the lungs.
Right.
And so this can be a problem in CHF where the heart is already struggling to pump efficiently.
Okay.
It can also happen during a COPD exacerbation, which is a sudden worsening of symptoms.
But it's not typical of pneumonia.
Okay, so really we're starting to see the time of day
Yeah.
when these things are happening.
Exactly.
That can also help us differentiate.
Absolutely.
Okay, what about chest pain?
Chest pain is a tricky one because it can mean so many different things, but in CHF, it often has this crushing, squeezing quality, and it gets worse with exertion.
Okay.
Kind of that classic angina pain that you hear about.
Right.
In contrast with pneumonia, the pain tends to be sharper, more localized,
Okay.
and worse when you breathe deeply or cough. And that's caused by inflammation of the lining around the lungs, which we call pleuritic pain.
Okay, so the quality of the pain
Yeah.
can actually give us some clues.
Absolutely.
Are there any other sort of physical signs that we can be looking out for?
Yeah, a few more.
Okay.
Clubbing or enlargement of the fingertips is uncommon in all three conditions,
Okay.
but can sometimes be seen in advanced COPD.
Got it.
And then there's cyanosis,
Yeah.
which we've already talked about.
Yeah.
The bluish tinge to the skin
Right.
indicates low blood oxygen levels, can occur in both severe COPD and CHF, but less common in pneumonia. And then, of course, that pursed lip breathing that we talked about
Right.
is very characteristic of emphysema.
Yeah. So
Yeah.
it's amazing how these subtle little differences
Yeah.
can really lead us down a completely different diagnostic path.
Absolutely. It's like putting together a puzzle,
Mm-hmm.
all these little pieces,
Yeah.
and you have to figure out where they fit.
Right. And I think the key takeaway here is that this is just a starting point.
Exactly.
Right? That's not the whole picture.
This is what we've talked about today is to kind of equip you
Yeah.
to go out and start asking the right questions,
You're-
start looking for those telltale signs.
Yeah.
But obviously, every patient is unique.
Absolutely.
Every situation is going to be different.
Sure.
So here's something for all of you out there to think about.
Okay.
How might a patient's age, their overall health,
Hmm.
and their medical history?
How might that influence how these conditions present?
Great question.
It's a really fascinating area, I think, for further exploration. So
Mm.
keep that in mind as you go through your
First studies.
careers as healthcare professionals. And as always, thank you so much for joining us for another Medvarsity Deep Dive.
Thanks, everyone.
We'll see you next time.